Hi, I'm Dr. Nikki Kay, and I'm the author of Hormones, Health and Human Potential. And I want to talk a little bit about bone health. Now, you might think of bones and the skeleton as being slightly boring tissue, but in fact, bone is a very dynamic tissue. And every 10 years or so, our whole skeleton is recycled. There will be certain times in our life when the formation of the skeleton is favored over its resorption, destruction, in other words, and vice versa. If I tell you that the key hormone is estradiol in terms of bone health, estradiol is the queen for bone health. If I explain that, then you will realize why there's such a rapid increase in bone mineral density, the strength of the bone, during the teenage years, because this is when the reproductive hormones spring into action. By the way, estradiol, you might be thinking this is just a hormone found in women, but to point out that men also produce estradiol. In men, testosterone is converted to estradiol. So this applies to men and women during the teenage years. Peak bone mass will be accrued thanks to the hormones. During adult life, although the bones are continuously being recycled, the bone mineral density remains about steady. As we get older, and certainly for women when we reach menopause around the age of 50, 51, there is a decline in estradiol, and therefore, consequently, a decline in bone mineral density. If bones become very thin and brittle, this is a situation known as osteoporosis. So what can you do to ensure that you have the strongest, healthiest bones possible to serve you throughout your life? Well, really, it's a case of taking care of your hormones, in particular, the production of estradiol. So this means maintaining a good balance between nutrition and exercise and sleep. All these factors are known to impact bone directly, but also via the production of hormones. In terms of exercise, weight-bearing exercise, loading the skeleton, providing what's called an osteogenic effect is really helpful. But this must be in combination with the factors of nutrition and sleep that I mentioned just now. So I hope you found that useful and that you have some ideas of how to make sure and ensure that your bones are as strong and healthy as possible throughout your life.